And I also saw many, many patients who, and I still to this day, once a week we have someone comes in who says, I got my mom back, or I'm no longer forgetting words. I remember the names of my neighbors. I remember the thing that I went to grab in the other room. I don't have that brain fog anymore. We hear these stories over and over and all the time. This is what we expect now. The exception is when people are not improving. And then I appreciate Dr. Bredesen so much because he's like, Heather, just bring me whatever's not working and let's go through it and let's figure out what we're missing, because there's some piece of the puzzle that we're missing. So through Dr. Bredesen's work, I had the privilege of seeing patients in my clinical practice after being trained by him. And then patients were asking me the question, if I do this, or their loved ones especially were asking, if I do this for my mom or my dad, if I take the time off work, if I put in the effort, if we spend the money that it takes to do all of this, how likely is it to work? And we didn't know at that stage. This was in 2018, 2019. And so I was really fortunate to get a grant to study this and do a clinical trial in my office. And what we showed was that with the 6-month intervention, 74% of our participants with mild cognitive impairment, with measurable cognitive impairment, improved their MoCA scores, or their Montreal Cognitive Assessment, as well as another cognitive test called the Cambridge Brain Sciences Battery of Cognitive Assessments. And we also saw improvements in quality of life and in sleep and in many other factors, including their diabetes management, blood pressure, and their depression, their quality of life, but their mood and sleep in particular.